everyone for staying to this time. It's a hard thing to present just before lunch, but I'll do my best. All right, I am presenting this research paper on behalf of Andrew Fraser, who is our Aboriginal Health Services Manager. He's a nutrition scientist and elite performance coach. And he's unable to be here today because he's got a brand new addition to his family. And I will try my best to deliver. I cannot do and just, I can't do what Andrew does, but I'll do my best. Thank you. All right, I'll give a quick background to our study and provide a bit of the results we've had from our evaluation and a few concluding statements. Some of you may already know that the rate of diagnosis of diabetes among young people in our indigenous populations is significantly high, and some research shows that it's up to 8 times higher than the rest of the population. In Western Sydney, where we work, a lot of our young people are disengaged with education and employment, and this leads to lower socioeconomic status, poor nutrition, and low physical activity because it prevents them from being able to participate in these programs. A major barrier to physical activity and proper nutrition is, the financial barriers that are often faced by our young people. Physical activity, however, has been proven to be a very effective mitigating factor for chronic diseases, and this is something that we are here to celebrate today. However, for our Aboriginal young people, there are so many different barriers that prevents them from being able to participate in physical activity, such as lack of connection with community and their culture. There are multiple different financial constraints that prevents participation, especially the cost of going to a gym, for example. There continues to be a lack of understanding around exercise protocols and the different types of programs that work for Aboriginal youths. The added burden of transportation that is associated with living in some of our low-income communities is quite an important barrier. And of course, we have continued to find a lack of evidence to support some of the work that's needed in this particular age group. And we believe that while these barriers exist, the programs are not addressing the particular barriers that prevent participation. So this brings us to our program. We wanted to do something about these barriers to see whether or not we could enable our Aboriginal youths to have a better chance of participating in physical activity programs. So we developed a program to reduce the barriers to participation and the continuation of physical activities among Aboriginal youth. And that brings me to our program that we call the Young, Strong and Deadly. We designed the Young, Strong and Deadly program to help us to see whether if we try to address some of these barriers, whether this would help our youth to be able to not only participate in, but to continue to participate in physical activity programs. So the Western Sydney Local Health District, our Youth Health Unit and our Aboriginal Health Hub partnered with some of our Aboriginal community control organizations and the Police Youth Club in Shalvey in Mount Druitt area to implement this program. The program is aimed at enrolling Aboriginal youth aged 12 to 16 years old who live in the Mount Druitt area. And while we initially targeted males, we left it open so females would participate. We included 14 consecutive weeks of training that included strength and conditioning, a bit of nutritional training as well, and a big part of it included social connectivity. So in terms of our food education program, This was aimed at encouraging Aboriginal youth to be able to eat traditional foods that they were familiar with, but also to teach them how they could prepare meals, healthy meals for themselves, and to teach them some practical skills about safety in the kitchen. This also ensured that they were using traditional ingredients in preparation of food. In terms of our social connectivity, this was an opportunity also for youths to connect with other Aboriginal youths in a safe and friendly environment. And I may have missed saying that this program was led by Aboriginal coaches. Both Andrew and another coach who was also trained was supporting these young kids in this program. In terms of our exercise education, this followed a dynamic conjugate program with the focus on increasing physical development by developing proprioceptive and neuromuscular adaptations over time. This was supplemented by classroom education on the basics of energy and muscle systems. So we wanted to make sure that we were capturing data to test whether this program that we were implementing was working. So we evaluated the program using a mixed methods, qualitative and quantitative pre-post study design. In this design, we used several different pre-post surveys to capture the baseline data around their physical abilities, their strengths. We also captured data on their education around physical activity, nutrition, etc. And then at the end of the 14-week period, we went back and measured their physical activity, strength, and conditioning. And we also included a qualitative component where we spoke to the kids and their parents at the end of the 14 weeks again. So for some of our findings, we successfully registered 30 youths in the program. 24 of them completed the program. We had 16 males and 8 females completing. Males had a slightly higher attendance rate than females, and what we found was an exponential increase in their strength and conditioning over that 14-week period. This was significant both for males and females. On average, the maximum deadlift increased by 13.9 kilograms. We saw push-ups increase by 6, plank duration increased by about 36.7 seconds, speed increased by 7%. However, while we didn't see any significant changes in their body mass index over the period, there was an overall increase in their strength, speed, and conditioning. In addition to those matrices, we also implemented the personal well-being index for youth in our surveys, and we asked the students to rate them their own well-being. We saw a significant increase in well-being over the 14-week period. However, we did notice that the males initially rated themselves lower than females, and at the end, the females rated themselves lower than at the beginning. And we think that this was an artifactual kind of finding, but we really wanted to see how these youth thought they were doing from a well-being perspective. We also looked at their knowledge. We saw increases in knowledge of the Australian guidelines around nutrition and exercise. We saw an increase in the consumption of fruits and vegetables and water over the period of time. And in conclusion, what our data told us was that we had a high retention rate. We saw significant improvements to strength and conditioning. We also saw quite a good amount of social and emotional connectiveness amongst young people. Some of the youth that came, our coaches identified those with leadership qualities, and we allowed them to lead smaller groups of participants, which helped to create a lot of rapport among the youth. In terms of value for money, our study emphasized the value of collaboration and community partnerships in implementing preventive health strategies for our priority communities, which is one of the important strategies of not only New South Wales Health, but our local health district as well. We also found that the integrated community co-design approach that we used, that saw the partnership between health, the Aboriginal community control organization with an Aboriginal leadership at the front of this study, provided a culturally appropriate and a safe environment for these students to participate and to engage with physical activity. We had a yarning circle at the end with the kids, and they all really expressed how much the program meant for them, the value it brought to them, and the fact that the program was helping to address some of those barriers that they saw that would prevent them from participating in physical activities moving forward. And this was one of the things that we really wanted to address. And the transportation and the ability to get to the gym, the cost of paying for a gym membership is something that we try to address by providing the transport for them to and from the gym and paying for that gym membership. We also provided gym membership for them for another 6 months at the end of their participation in the program. So we believed that our intervention was effective. It is transferable. This can be translated from our local health district to anywhere else. But we also believe it's a sustainable program, and our health district is also looking at continuing to implement this program as a part of our business as usual. And just wanted to express thanks to the various organizations that we've partnered with to implement this, including our PCYC at Shalvi and our Aboriginal teams throughout Western Sydney Health District. And thank you so much for your time.
Thanks, Stephanie. Great presentation. What a wonderful program. We have a few questions here. I think you did touch on this just in your last slide, but where did you run the program in Mount Druitt, and is it still continuing?
Yep, so the program was run at the Police Youth and Community Club in Mount Druitt, at Shalvi campus, but it was run by the health district staff with support from the people at the community club. And is it continuing? Yes, the health district is now going to be hiring permanent staff to implement this ongoing in the district.
Amazing. Will you assess the long-term impact, for example, the sustainability of wellbeing improvements from the program?
Yes. So our evaluation study that we've implemented as part of this program, it's got a follow-up component that we will assess. We will be assessing the participants. We have ethics approval to follow up for 6 months post at the end of the program. So we're almost at the end of the 6 months now, and we're about to collect that follow-up data.
How does the program scale or inform practice more broadly? What part of the program can be implemented in other communities, do you think?
I think the program is scalable. What we did was our health staff implemented the program, we designed the program, but we worked in partnership with community. So it wasn't just us just going out there doing this. We worked with the schools in the community to identify students who they thought would benefit from this type of intervention. And I believe that this program is easily scalable across communities if you are able to really, ensure those partnerships are in place, ensure you have those existing relationships, and of course, that desire to see the change. But the actual implementation part was not really that difficult because we already ensured that all the support systems we needed and those partnerships were in place.
Right, one last quick one before we let everyone get to lunch. During the yarning, do you have any ideas about what negatively impacted the women's wellbeing post-program?
Can you just repeat that?
Just when the women's results was positive or was more positive at the start of the program in terms of their wellbeing results. Do you have any ideas? Was there any subjective comments in the yarning process?
No. I think from the yarning process, we really realized that I think the girls probably thought they were doing a lot better when they started out than they really were. So I think it was kind of more like a reality check for them at the end when they particularly understood a little bit better around that. I think they were just being modest. What we did see from the yarning though, that they really appreciated the connectedness, that social connection with other kids from their local district, having a friend to go to the gym with them, and being able to do this in a group setting than just by themselves. So we really didn't see anything particularly standing out that we thought could have influenced that in the results.
Great, thanks Stephanie.
So much.
Thanks everyone for attending this session. Thank you again to all of our speakers. Yeah, ready to go to lunch. Enjoy.
Thank you. Thank you for joining me. Presentation is finished. Hope you enjoyed that. Thanks for joining me. Bye-bye.